In the second part of this lecture, we'll discuss on the anti-inflammatories, which are drugs that can reduce inflammation. So imagine if you were to design some anti-inflammatories, what are the features that you must include? Well, first of all, you might want to reduce the painful sensation. So this property is known as analgesic. Then you want to reduce the permeability of capillaries to reduce swelling. And you also want to reduce the white blood cells migration that triggers even more inflammatory response. You also want to reduce body temperature. And this property is known as antipyretic. So this can be done by reducing prostaglandin production. Or you want to suppress the immune system in the first place, such as in the case of organ transplant. So that is called immunosuppression. Or you might want to interfere with the immune cell responses. Depending on the specific needs, these are the drugs that we can use to combat pain and inflammation. And the most commonly prescribed anti-inflammatory drugs are the NSAID, which stands for the non-steroidal anti-inflammatory drugs, such as aspirin. But sometimes, if the symptoms are more severe, we will need to use glucocorticoids. So these are steroidal anti-inflammatory drugs. And it is not a good idea to take steroid for long term. I'll tell you why in a while. And then you also have the immunosuppressants, which are drugs that can reduce your immune responses. So as I mentioned just now, you will take this after organ transplant to reduce the immune responses towards the donated organ. Or sometimes you have to take this if you have any sort of autoimmune diseases such as arthritis. And when you have allergy, which is a type of hypersensitivity, you will need antihistamines because these are the antagonists or the substances that can block the histamine receptors. And now let's look at some examples of the NSAID. So I believe most of us, if not all, we have taken paracetamol in our lifetime, and we take them to relieve pain because paracetamol is an analgesic and also to relieve fever since it has the antipyretic activity. So paracetamol is a very unique drug because it is an anti-inflammatory drug that has no anti-inflammatory action. And for this reason, sometimes paracetamol is not even classified as an NSAID. And if overdose, paracetamol can actually damage our liver. Now, how about aspirin? It inhibits your cyclooxygenase enzyme irreversibly, which prevents prostanoid production. Remember, prostanoids are the precursor to make all sorts of eicosanoids that are involved in inflammation. And at the same time, aspirin also has the antiplatelet activity, which explains why the major function of aspirin is actually a blood thinner, that is to reduce the risk of thrombosis. But taking too much of aspirin could lead to internal bleeding as well as gastric irritation. Next one is ibuprofen. It is a classic type of NSAID as it has both the analgesic and anti-inflammatory activity. So like aspirin, ibuprofen, taking too much of it can cause gastric irritation, while the last example is celecoxib. So this one has fewer gastric side effects because it selectively inhibits another isoform of the COX enzyme. This time is the COX-2 enzyme. While for the rest, aspirin and ibuprofen, they are inhibiting both COX-1 and COX-2 enzyme. So the drawback of having this drug is that it can increase the chance of getting heart attack, and it's not recommended for women with pregnancy of more than 30 weeks gestation period. Okay, this is just to show you that Panadol can actually kill if you're overdose, and as few as 15 paracetamol tablets can cause an irreversible liver damage or even death. So as mentioned earlier, cyclooxygenase is the enzyme that converts arachidonic acid into prostaglandin and many more eicosanoids. But there are two major isoforms of cyclooxygenase, which are COX-1 and the COX-2 enzyme. So COX-1 is a housekeeping gene that is switching on all the time, producing prostaglandin, especially in your stomach, that acts as a layer of protection on the stomach lining. So this explains why you will get all sorts of gastric irritation and ulceration with the use of ibuprofen or aspirin, while certain drugs like the celecoxib is more selective towards COX-2 enzyme, which is only turned on or induced during inflammation. Therefore, celecoxib has fewer gastric side effects. However, it doesn't mean that COX-6 are always good and safe to use because they are associated with increased chance of thrombosis and heart attack. Rofecoxib, for example, was taken out of the market in 2004 because of increased risk of heart attack and stroke. And the reason why inhibition of the COX-2 enzyme could lead to these side effects are still unclear. But it reminds us that designing a drug is never easy because it will require full understanding on the enzymatic action and pathways. And next, we'll look at glucocorticoids, which can bind to our DNA, affecting the transcription of genes related to inflammation. Then, you also have the immunosuppressive drugs that suppress the activity of our immune cells, leading to reduced cytokine expression, increased lipoprotein synthesis, which stops inflammation, and reduced COX enzyme production. So overall, these activities lead to the inhibition of phospholipase A2 activity, and this enzyme is required in the making of eicosanoids. As a result, you will get reduced eicosanoid production, and that leads into less of the inflammation or inflammatory symptoms such as reduction in vasodilation, reduction in swelling, and all classic symptoms of inflammation. Okay, one of the important effects of glucocorticoids is to reduce the activity of the phospholipase A2 and the platelet activating factor. As a result, you'll get less of the arachidonic acid production and subsequently less eicosanoids. But what is the underlying mechanism for this process to happen? So, when you administer glucocorticoid either topically or orally, they can enter into a cells as these are lipid molecules that can go through the plasma membrane. So within the cell, they can then bind to the glucocorticoid receptor and enter into your nucleus. Here is when it does the magic. Because glucocorticoid could bind to DNA regulatory sites and modify your gene expression. So it could be inhibition or induction of certain genes that are involved in inflammation. And due to that changes, you'll get a reduced inflammation. So what are the gene targets for glucocorticoids? Well, it upregulates production of tyrosine aminotransferase, which is an immunosuppressant, and it increases the production of lipoprotein or annexin A1, which is an anti-inflammatory. At the same time, it downregulates the gene regulated by NF-κB, such as the COX gene, and it also downregulates the genes controlled by AP1, which are involved in wound healing. So for your information, both NF-κB and AP1 are the transcription factors. So do you think it is a good idea for diabetic patient to use glucocorticoids? No. But why? Because they already have very slow healing process. So using steroid will only make things worse. Okay, these are just some additional information that some Chinese herbs contain natural steroids, such as in the licorice root, ginseng, cordyceps, and so on. You could see that their active compounds are actually different types of glucocorticoids. And that explains why they have amazing anti-inflammation or anti-inflammatory effects. But sometimes you will find these illegal herbal products in the market. So these are super effective drugs against inflammation because they are adulterated with steroids, such as dexamethasone and so on. So for instance, your grandma might find her Jinlong snake's bones rheumatic capsules way much better than the drugs prescribed by her specialist. Of course it does. Just look at the ingredients. What do you have here? You have all sorts of steroids and even paracetamol in it. So as long as you consume these products, all symptoms will be amazingly disappeared. But do they heal a sickness? Of course, no. And is there any drawback? Sure, yes. That's because prolonged use of steroid could lead to the Cushing syndrome due to the buildup of cortisol or corticosteroid in your body. So these are the symptoms of Cushing syndrome. You have moon face or round face, purple striae, and the buffalo hump. And you will get easy bruising. Remember, as the AP1 regulated genes are downregulated, it will take a long time for wound healing to happen. And you also get muscle wasting and arteriosclerosis due to an increased level of cholesterol. You'll get some emotional instability, and last but not least, hyperglycemia because steroid can stimulate gluconeogenesis. Okay, these are just some suggestions for your self-directed study. You may refer to a textbook or any resources online to cover these topics. And these are the recommended references. The Jan Weiss Immunology is also useful for your microbiology, but I personally prefer the second textbook, which is the Rang and Dale's Pharmacology. With that, we have come to the end of this lecture, and now try to answer these questions again. If you could do so, it means you have understood the concept well.